My name is Nina Resetkova. I'm a physician with Boston IVF, and I work at the Downtown Boston Center. Specifically, I'll be talking with you about LGBTQ plus family building. That's an area of clinical and research interest for me. As far as the initial kind of discussion, I think it's always good for you all to know, what does a reproductive health checkup entail? So what happens when you call a fertility clinic for a fertility evaluation to explore your options? Well, you're typically booked for about a 45-minute or 1-hour appointment with a reproductive specialist. It could be one of our nurse practitioners, one of our physician assistants, or one of our physicians. We do have centers all over New England and also in other regions as well. So we'll try to get you plugged in with somebody who's close to you. We have centers for monitoring across our regions as well. That provider will review your medical history and make some plans for fertility testing as well. And there'll be some discussion of potential treatment options and as well associated timelines and costs of treatment as well, should you choose to proceed. We at Boston IVF are a full spectrum fertility care center. So we can help you with a fertility workup, fertility testing. We can also monitor your natural cycle if that's of assistance, particularly for treatments like insemination with donor sperm. We do egg freezing, in vitro fertilization. Also, something that we'll talk about today that people ask a lot of questions about is partner-assisted reproduction, as well as egg donation and surrogacy. So what does a fertility evaluation involve? Well, typically you're going to have an ultrasound starting out. If you're somebody with ovaries and a uterus, you're going to have an ultrasound to evaluate the anatomy. And that ultrasound can be done a couple of different ways. Most often we do an internal ultrasound because the anatomy is pretty small, so it's more easily seen intravaginally. However, if you're not comfortable with that, a transabdominal ultrasound can also be performed to evaluate the ovaries, which are right here. And then the uterus and whether there's any abnormal structures in either of those. Some blood work as well. If you are assigned female at birth, you're going to check the ovarian reserves, the activity of your ovaries through some blood tests, including an anti-Müllerian hormone or AMH. We're also going to do some prenatal labs to make sure that you're healthy for any treatment or pregnancy, do a standard STD panel, and then, of course, genetic testing as well if you're interested in having a genetically linked pregnancy, understanding if there's any genetic risks that may be passed on to your pregnancy, some of which may be able to be prevented through in vitro fertilization. We also test for folks who are interested in donor insemination for CMV, cytomegalovirus, to make sure that we know what kind of donors you're eligible to choose. If you're interested in donor insemination, it's also a good idea to get an HSG, which is a hysterosalpingogram. That's called a dye test. Sometimes you hear about it as a dye test of the uterus and tubes. And it basically involves putting some dye with a catheter through the cervix, which is the opening to the uterus, spilling the dye into the uterus, which then kind of expands the walls here of the uterus. And you'll see kind of looks like an inverted triangle. And then if the fallopian tubes are open, the dye will spill through the tubes as the dye is being passed through. And we take pictures of that with X-ray. So we can understand if your fallopian tubes are normal and if the egg and the sperm are able to meet in the fallopian tubes and travel together as an embryo down to the uterus for implantation. So people who are thinking about doing insemination often ask, why do a checkup before starting treatment? I can do insemination at home. Maybe you have a known donor that you want to work with. Well, it's really important to review all the medications that you're taking, manage any underlying health conditions that you may have, and really this sort of broad concept of preconception counseling is really critical in optimizing your health for pregnancy, your chances of success for pregnancy, as well as your health for pregnancy. If you have any underlying gynecologic issues, such as uterine fibroids, irregular cycles, polycystic ovarian syndrome, or endometriosis, those can be addressed there. And certainly folks with those underlying conditions are going to benefit more from doing treatment at a fertility clinic to optimize your chances of success. So artificial insemination, very, very common starting point if you're working with donor sperm. And this can be done through a couple different ways. The way that it's done at Boston IVF is through an intrauterine insemination or IUI, but it can also be done at home with an intravaginal or kind of cervical insemination. The difference is that if the sperm is going into the uterus, it has to be washed beforehand and stripped of these proteins, which can be irritating to the uterine lining. And so at a clinic, a fertility clinic, it's going to be a washed sperm sample, and it's going to be entering the reproductive anatomy at a much higher point up in the upper portion of the uterus. So essentially more sperm are able to get through the uterus and up into the fallopian tubes to meet the egg. There's sort of varying treatment strategies based on your history and your goals for family building, but generally, if you're under 35, it's reasonable to do about 6 rounds of insemination before thinking about more aggressive treatment strategies. Then if you're over 35, less treatment cycles, or potentially even considering more aggressive forms of treatment like IVF sooner. And it's important to know that there's a number of different ways that insemination can be performed. Some cycles can use medication to coordinate the growth of your follicles, and some cycles don't need any medication at all. We can use your natural cycle. So what about the next step? What if you're not successful with insemination? Well, IVF may be a great treatment option, either first line, or if you haven't been successful with inseminations, be they home inseminations or clinic-based inseminations. IVF is highly successful in some of our most successful age groups under 35. The success rate can meet or even some cases exceed 50% per treatment cycle. So highly successful, but the success rate is age dependent. In vitro fertilization involves taking shots, so daily injections, and you're taking those in your belly generally. They're pretty well tolerated, not too many reactions, but it is typical to feel bloated because you're going to be making a lot of eggs with the stimulation, and some fatigue is common during IVF treatment as well. You do need to have some blood work and ultrasound done regularly to monitor the progress. And then ultimately you have a surgery to extract the eggs, and that's done under anesthesia, so you're comfortable. We can also, with IVF, test embryos for genetic defects as well as chromosomal abnormalities. And embryos through IVF can be transferred at the same time that they're created. That's called fresh transfer, or they can be frozen and thawed at a later time for transfer. And depending on your particular case, you may benefit more from one versus the other approach. So what about reciprocal IVF? We hear a lot about that. It's of growing interest to our same-sex female population. People who are interested would benefit from it if they're interested in being a genetic parent, but they're not interested in carrying the pregnancy. So essentially, one partner with ovaries undergoes a stimulation for an egg retrieval, and then the second partner with the uterus undergoes preparation of the uterine lining for the embryo transfer. This can all be done real time. It can be coordinated to happen as a result of one treatment cycle, or it can be done over the span of a couple of months once we have some additional information about the embryos that have been created. For example, genetics, or simply the quality and the number of embryos. This provides a tremendous opportunity for involvement of both partners in the process of family building, and the success rates are excellent. We've done a lot of research in reciprocal IVF, really contributed to the literature internationally on this topic, and the success rates are excellent. So definitely, if you're interested in this strategy, talk to one of our team members. We can tell you more. For our transgender patients, for those who are assigned female at birth, there are a number of treatment strategies that are available. For fertility preservation, so preserving your fertility before starting any gender-affirming treatment, you can consider freezing your eggs or even freezing some of the ovarian tissue. We don't offer that as a tissue preservation, but we do actually do a lot of treatment for egg freezing before starting testosterone. Sometimes our trans patients are interested in carrying pregnancy, so donor insemination would be an option, or reciprocal IVF with a partner carrying the pregnancy. Some of the specifics of things that we can do for our trans patients, which can make it a little bit more comfortable to undergo treatment, really working on fostering an open and inclusive environment. We do also work with many of the major insurance and workplace benefits plans, so we can offer you a center, that works with your coverage to optimize and really minimize your out-of-pocket expenses. Some of the things that my transgender patients really appreciate is the possibility of not inducing a menses, not having a period prior to treatment, and that is possible through careful monitoring of your testosterone levels. We can also offer transabdominal ultrasound through the process of fertility treatment and work towards less frequent or more flexible monitoring. And I think a lot of this comes down to having good rapport with your medical provider, just really feeling like kind of we understand the journey that you're on. We did participate in a landmark study on assisted reproductive outcomes for female to male transgender patients. So this has gotten a lot of interest and provided a lot of education for our colleagues across the country. We also do a fair amount of surrogacy for male individuals and couples. If you're interested, definitely reach out. We do have a third-party program that can provide you with a lot of information about costs of treatment, timelines for treatment, some of the specifics, the legal specifics as well that are involved. I will share with you that the success rates with surrogacy and egg donation are tremendously high, and that you can work with somebody who is known to you as an egg donor or a surrogate. Although we also work with several donor egg banks. So if you're interested in working with a donor egg bank, we work with several reputable egg banks with high success rates. So definitely happy to talk with you about these options as well, if that's something that applies to you. So that's the kind of overview of my discussion points today.